This information out of New South Wales, which was very interesting in light of a number of debates through the pandemic and indeed your questioning of the then Premier Gladys Berejiklian, we've heard so much through the pandemic, we're following the health advice, not just from former Premier Berejiklian, but others as well. Today, there's evidence that, no, they haven't followed it to the letter.
No, that's right. And the 11 a.m. press conference was such a fixture, including on Sky, where we told the truth all the way through. So the former New South Wales Premier Gladys Berejiklian insisted, like all leaders in Australia have seemed to insist throughout the pandemic, that she was acting on health advice when she implemented various stages of the lockdown after the Bondi outbreak in June. The lie has been put to this in this email from her Chief Health Officer, Kerry Chant, to the Minister on July 13. At the time, Berejiklian announced a 2-week lockdown extension but kept retail and other services open. The advice clearly said, in summary, recommend stage 4 restriction approach outlined in Victoria with the exception of permitting takeaway food. It took weeks before Gladys Berejiklian had to go with harder lockdown measures until the vaccination rate could be lifted sufficiently. This advice came to light after a call for papers by the Upper House came to light this morning. Just one day after this advice was sent, I had this exchange with Berejiklian. Premier, you've locked us down for 3 weeks. You're now locking us down for another 2 weeks. We're all homeschooling. We're all locked down. What's to say it's not going to be another 2 weeks on top of that? And you keep saying the settings are right. 33, 24, 28, infectious in the community, stays the same. When are you going to acknowledge it's time to lock it down harder to get rid of this thing?
The people of New South Wales know that our government has access to the best health experts in our nation. And please know that we are never afraid to take those difficult decisions required to keep our community safe. If we need to adjust those settings, we'll rely on the best health advice to do that.
With respect, the best health advice has just got us a 5-week lockdown. That's what the best health advice has got us, hasn't it?
We took the action we did when we did to avert medical and health disaster. And we stick by our decisions because they're based on the best health advice.
Can you guarantee us this will end on July 30?
We've always relied on the best health advice.
Will we be opening up or not? Or will we be locking down more, in your personal opinion, from everything you know? All the advice that you have.
It's very dangerous to ask about my personal opinion. It's never about our personal opinion. It should always be based...
What health advice are you getting about the likelihood of opening up on July 30?
The same health advice we provided yesterday and the day before, and I will ask Dr Chant.
Do you expect to be opening up on July 30?
I will ask Dr Chant to... I wish I had a crystal ball.
What if you say 1 hour of exercise a day and shut retail? Are you saying that would have no difference in terms of when we come out of this?
We always base our decisions on the best health advice and on the best information available.
Well, we just saw the health advice, it wasn't that. Now, New South Wales Deputy Liberal leader Stuart Ayres has tweeted, Reid, this story that was in the Sydney Morning Herald today, that the current Deputy Liberal leader, who at one point on the urgings of the federal government urged Berejiklian to lock down harder in the committee meetings, by the way, but he said, so New South Wales Labor's approach was to have harsher lockdowns, longer curfews, sounds a lot like Victorian Labor, no thanks. However, the documents released to the Upper House also show the recommendation was for the whole of Sydney and it was restricted to Western Sydney, including Ayres' electorate. Irrespective of where you are at on this issue, it's reasonable to say what Berejiklian said at these 11 a.m. press conferences for several weeks in terms of the health advice was simply not true.